The normal aging process is best defined as the time when A. People become dependent and childlike. B. Alzheimer's disease begins. C. Normal body functions and senses decline. D. People are over 65 years of age. Answer: C. Normal body functions and senses decline. If a client is confused, the nurse aide should A. Ignore the client until he starts to make sense. B. Restrain the client so that he does not hurt himself. C. Keep the client away from other clients. D. Help the client to recognize familiar things and people. Answer: D. Help the client to recognize familiar things and people. What is the process of restoring a disabled client to the highest level of functioning possible? A. Responsibility. B. Retention. C. Rehabilitation. D. Reincarnation. Answer: C. Rehabilitation. When changing an unsterile dressing, the nurse aide should wash hands. A. Before the procedure. B. After the procedure. C. Before and after the procedure. D. Before, after removal of the soiled dressing, and after the procedure. Answer: D. Before, after removal of the soiled dressing, and after the procedure. Clean bed linen placed in a client's room but not used should be A. Returned to the linen closet. B. Used for a client in the next room. C. Taken to the nurse in charge. D. Put in the dirty linen container. Answer: D. Put in the dirty linen container. The nurse aide finds a conscious client lying on the bathroom floor. The first thing the nurse aide should do is A. Help the client into a sitting position. B. Call for assistance from the nurse in charge. C. Offer the client a drink of water. D. Check for signs of injury. Answer: B. Call for assistance from the nurse in charge. If a nurse aide finds a client who is sad and crying, the nurse aide should A. Ask the client if something is wrong. B. Tell the client to cheer up. C. Tell the client to stop crying. D. Call the client's family. Answer: A. Ask the client if something is wrong. Clients have the right to A. Smoke in any area of the facility. B. Have access to a telephone. C. Go anywhere in the facility. D. See other clients' medical reports. Answer: B. Have access to a telephone. Proper use of a waist restraint requires that the nurse aide A. Release the restraint every 4 hours. B. Watch for skin irritation. C. Tie restraints to the side rail. D. Apply the restraint tightly so the client cannot move. Answer: B. Watch for skin irritation. A client needs to be repositioned but is heavy, and the nurse aide is not sure she can move the client alone. The nurse aide should A. Try to move the client alone. B. Have the family do it. C. Ask another nurse aide to help. D. Go on to another task. Answer: C. Ask another nurse aide to help. To prevent dehydration of the client, the nurse aide should A. Offer fluids frequently while the client is awake. B. Wake the client hourly during the night to offer fluids. C. Give the client frequent baths. D. Feed the client salty food to increase thirst. Answer: A. Offer fluids frequently while the client is awake. When transferring a client, most of the client's weight should be supported by the nurse aides. A. Back. B. Shoulders. C. Legs. D. Wrists. Answer: C. Legs. To be sure that a client's weight is measured accurately, the client should be weighed. A. After a meal. B. By a different nurse aide. C. At the same time of day. D. After a good night's sleep. Answer: C. At the same time of day. How many tips does a quad cane base have? A. 1. B. 2. C. 3. D. 4. Answer: D. 4. Before taking the oral temperature of a client who has just finished a cold drink, the nurse aide should wait. A. 10 to 20 minutes. B. 25 to 35 minutes. C. 45 to 55 minutes. D. At least 1 hour. Answer: A. 10 to 20 minutes. Which of the following methods is the correct way to remove a dirty isolation gown? A. Pull it over the head. B. Let it drop to the floor and step out of it. C. Roll it dirty side in and away from the body. D. Pull it off by the sleeve and shake it out. Answer: C. Roll it dirty side in and away from the body. To prevent the spread of infection, how should the nurse aide handle the soiled linens removed from a client's bed? A. Shake them in the air. B. Place them in a neat pile on the floor. C. Carry them close to the nurse aide's body. D. Put them in the dirty linen container. Answer: D. Put them in the dirty linen container. What would be the best way for the nurse aide to promote client independence in bathing a client who has had a stroke? A. Give the client a complete bath only when the client requests it. B. Encourage the client to do as much as possible and assist as needed. C. Leave the client alone and assume the client will do as much as she can. D. Limit the client to washing her hands. Answer: B. Encourage the client to do as much as possible and assist as needed. A safety device used to assist a dependent client from a bed to a chair is called a posy vest. B. Hand roll. C. Transfer or gait belt. D. Footboard. Answer: C. Transfer or gait belt. If a nurse aide needs to wear a gown to care for a client in isolation, the nurse aide must: A. Wear the same gown to care for all other assigned clients. B. Leave the gown untied. C. Take the gown off before leaving the client's room. D. Take the gown off in the dirty utility room. Answer: C. Take the gown off before leaving the client's room. When making an occupied bed, the nurse aide should: A. Put the dirty sheets on the floor. B. Help the client to sit in a chair while the bed is being made. C. Lower both side rails before changing the sheets. D. Raise side rail on unattended side. Answer: D. Raise side rail on unattended side. The nurse aide is in the employee dining room. A group of nurse aides are eating lunch together and begin discussing how rude a certain client was acting. The nurse aide should: A. Join in the conversation. B. Suggest that this is not the place to discuss the client. C. Be quiet and not say anything to the other nurse aides. D. Return to the unit and tell the client what was said. Answer: B. Suggest that this is not the place to discuss the client. The nurse aide enters a client's room and the client states that he has pain. What should the nurse aide do? A. Report it to the nurse in charge. B. Tell the client to get out of bed for a while. C. Tell the client that the pain will go away soon. D. Ignore the client's statement. Answer: A. Report it to the nurse in charge. A client is upset and crying over the recent death of her husband. How should the nurse aide respond? A. Tell her not to cry because it will make her feel sad. B. Close the door and leave the client to cry alone. C. Take the client to an activity to help her forget her husband. D. Sit with the client and allow her to talk about her feelings. Answer: D. Sit with the client and allow her to talk about her feelings. Which temperature is considered most accurate? A. Oral. B. Axillary. C. Groin. D. Rectal. Answer: D. Rectal. What is a beginning sign of a pressure sore? A. Swelling. B. Numbness. C. Discoloration. D. Coolness. Answer: C. Discoloration. While assisting a client with denture care, the nurse aide observes that the upper plate is cracked. The nurse aide should A. Clean the dentures and return them to the client's mouth. B. Call the client's family. C. Call the dentist and make an appointment. D. Report the damage to the nurse in charge. Answer: D. Report the damage to the nurse in charge. A new client refuses to wear a clothing protector at lunch. The nurse aide should A. Tell the client that he must wear it. B. Put the clothing protector on the client. C. Report this to the nurse in charge. D. Respect the client's wishes. Answer: D. Respect the client's wishes. The nurse aide can best show that he is listening to the client by A. Changing the subject frequently. B. Responding when appropriate. C. Correcting the client's mistakes. D. Directing the conversation. Answer: B. Responding when appropriate. The best time to prepare for a disaster is A. While evacuating residents. B. During lunch. C. When everyone is safely in bed. D. Before it happens. Answer: D. Before it happens.